Good morning, Dr. PK. This is a second video today about me answering questions, me answering to your questions. So this person responded on TikTok, of course, to one of my video about NSAIDs, ibuprofen and naproxen, the chronic use, and its a long-term effect on your kidney and other system. So his question was very simple. How long is too long when taking ibuprofen, naproxen, or diclofenac? So these medications, they are called NSAIDs, non-steroidal anti-inflammatory drugs. They are effective for pain and inflammation, but duration matters. So I'm going to explain in detail short-term, long-term, with supervision, without supervision. For general guidance for most adults, short-term use without supervision is really safe for many people. A week or so for minor pain, sprain, muscle strain, headache, occasional use for flare of arthritis. Too long without medical supervision, maybe 2 weeks, okay, maximum. Daily use beyond 2 to 3 weeks, you have to start really thinking about should you see a doctor or not. Any long-term daily use without doctor monitoring becomes too long at this point. Now, why duration matters? Because longer use increases the risk of stomach ulcer, bleeding, stroke risk, especially with diclofenac. Heart attack risk has been shown in the study, it goes up. Blood pressure goes up. Kidney injury risk, fluid retention, and if you have heart failure, your heart failure is gonna get worse. And risk is higher if you are over 60, have history of a stroke or heart disease, kidney disease, taking blood thinners, have prior stomach ulcer. So you have to be very, very careful. An important clinical principle we all doctors we use is you got to use the lowest effective dose and for the shortest necessary duration. If the pain lasts longer than a week or 2 weeks, it's time to ask, is it the right diagnosis? Is there a safer alternative? Should you take more topical? Do you need physical therapy? And those are questions you can definitely ask your doctor. So what about this duration under medical supervision? It changes. So when NSAIDs are used with medical supervision, too long becomes less about fixed number of days and more about risk management, monitoring, and indication. So let's break this down very clearly. How long can NSAID be used under supervision? So you are following with your doctor on a regular basis and he's monitoring it. Short-term supervised use. So I'll say 2 to 4 weeks for acute inflammation like back pain, tendinitis, arthritis, flare-up. Usually reasonable if no major risk factors, right? Now, medium-term use up to 3 months. Possible only if there's a clear diagnosis. You got osteoarthritis, inflammatory arthritis. You're taking lowest effective dose and no high-risk cardiac or kidney disease. And you are monitoring kidney function. You are checking it on a regular basis. At this stage, the doctor typically will monitor kidney function. We look for the creatinine number. We monitor blood pressure and ask you stomach, if you're having a stomach symptoms like heartburn, stomach pain, things like that. Sometimes we also add PPI like omeprazole to help prevent stomach-related issues. If long-term is more than 3 months, we call it chronic daily use. This is where caution increases significantly because chronic NSAID therapy may be a right treatment for severe degree of osteoarthritis and rheumatoid arthritis and ankylosing spondylitis to control the symptoms, and inflammation. But ongoing monitoring is very important. Kidney lab every 3 to 6 months. Blood pressure checks, hemoglobin to screen for silent GI bleeding, cardiovascular risk assessment. Those are very, very important aspect of NSAID therapy. when even supervised use of NSAID becomes too long. Even with monitoring, NSAID should be reconsidered if kidney function declines, blood pressure rises, there's a recurrent heartburn or anemia, patient has prior stroke or heart disease, age more than 65 with added risk factor, and if you are on blood thinners. Especially important, Diclofenac has increased cardiovascular risk compared to naproxen. In patients with a heart disease or a stroke history, long-term NSAIDs are generally avoided. So, supervision alone does not eliminate risk. It allows risk-benefit assessment, dose adjustment, and early detection of complication. But chronic daily NSAID use is really something like set it and forget it medication. It has to be monitored. That's an important thing to remember. If someone needs NSAIDs daily beyond maybe a month or two, it's time to reassess underlying pain strategy. Maybe you need physical therapy, weight loss, topical NSAIDs. Maybe you want to try acetaminophen, Tylenol, or inflammatory work, non-pharmacological pain management. So just remember those things, and maybe you want to save this video because NSAID use is quite prevalent, and this video was going to help you or someone you love. So thank you for watching, following through with comments and questions. I appreciate that very much.